My name's Clint Muench. I'm a general orthopedic surgeon for Summit Orthopedics. I played a lot of sports growing up, and for some reason always had an interest in the way the human body worked, the anatomy and the pathophysiology. And it seemed like orthopedics was a good way to blend the two, the sports medicine aspect and the anatomy and the human body part of it. And then our joint replacement practice, the arthritis part of it, fascinates me as well. A lot of orthopedic surgeons do injections to try to get pain relief for patients that come see us. And I found in my practice that using the ultrasound machine to guide the needle into a precise location makes the injection more accurate and hopefully more effective. So when I see a patient for the first time in the office, I usually try to take a very careful history, listen to their story, and make sure that I have all the fine details down. I then do a physical exam and then oftentimes get imaging studies, and usually start with plain radiographs. Most of the time you can make the diagnosis just with the history, the physical exam, and an x-ray. In other cases we may need to get an MRI scan to look at the soft tissues more accurately to confirm the diagnosis, and then we formulate the treatment plan, which oftentimes is non-operative. Physical therapy, time, and rest will oftentimes make people better. If those things aren't helpful, then sometimes it'll be more invasive, like an injection or an ultrasound-guided injection. And then sometimes surgery is what we need to do to make people better. Sometimes that's a last resort if all of the non-operative things haven't worked. Sometimes it's the first choice if their problem warrants surgery. Most orthopedic surgeons do hip replacement. I've found that changing to the direct anterior approach has been effective in my practice. I've found that my patients have less pain after the surgery, and they are able to stand and walk more easily using an assist device for a far shorter period of time after I switch to the direct anterior approach. One thing I love about my job is every day is a little bit different. You never know what you're going to see in the office. There may be a unique problem that you've never seen before, or there may be a patient that has a common problem that wants to seek a unique solution to their problem. And the surgical part of our job is the best ever. It's fun to make people better with a surgical option if they've tried everything else and it hasn't worked. When I'm not working, I spend a lot of time with my wife and our 3 boys. We like to hike and do sporting events together, and then I attend all of their sports activities. Other things I like to do when I'm not working include CrossFit to try to stay in shape. My wife and I cook and eat paleo together, and we like to play golf together as well.